Okay, so what is high definition liposuction for women? Now, this is a bit of a controversial topic and there's no clear-cut guidelines as such. So typically when you're talking about male patients, and whether it be high-def lipo, HD lipo, it's about doing liposuction along the abdomen to show the actual muscle bellies of the rectus abdominis or the six-pack muscles. Now, that is a quite popular procedure among male patients. Now, when female patients ask for that, there's a few more factors you've got to consider. First of all, do they have a strong enough of a core to actually make it look natural? Second, is their skin elasticity good enough for the skin to almost shrink wrap over the muscle bellies to make it look natural? Third, do the rest of the physique actually complement having that six-pack or the abs showing? Now, the reality is, a lot of men, if they have enough muscle on their body, they can have their six-pack actually slightly visible, even at a slightly high body fat. Now, that isn't the case with women. So if you artificially create a six-pack look on a female patient and the rest of their body doesn't look like someone who could actually have that kind of muscularity, it just ends up looking really weird. So I personally refuse to do them. So what I consider and what my patients consider as what is an aesthetic feminine abdomen and is considered almost high def or defined or toned is flatness with a bit of vertical definition for their ab definition. So ab definition in males and females are a little different, and that's my way of making people look realistic after the surgery. All surgical results, in my opinion, have to be believable, they're real. If the rest of someone's physique does not complement a particular part, they just do not act in unison and look, in my opinion, quite ridiculous. Okay, so you might have heard the term Lipo 360 and wonder what does it actually mean. Now, first of all, Lipo 360 is not an official medical term, and I have found that different people classify it differently. Now, how I classify Lipo 360 is five areas: your upper abdomen, your lower back, your love handles or the flanks, and the sacral region. And the goal of Lipo 360 is to try to make your abdomen as flat as possible and letting some of the abdominal contour show to make it look more athletic. The lower back region is to really make the waist as small as possible. With your love handles, instead of bulging outwards, you want to make it curve in and concave in to make a more harmonious transition down to the hips. And the sacral fat pad is the part just above your bum in the middle. The idea with the sacral area is you want to get rid of the fat pad there to increase the curvature coming down onto your buttocks from your torso. So that is what I consider as Lipo 360 and consists of 5 areas. Why do results of liposuction and fat transfer surgeries vary between patients? Now, I get a lot of patients coming in with inspo photos to show me, saying, "This is your patient, can you make me look like her?" Now, that's a very common request. Now, the reason why I can't say yes to any of those is because no two humans are exactly the same. The few factors that determine the results of liposuction and fat transfer are your musculoskeletal anatomy, what's actually underneath the fat. Two people could have exact same body weight, body silhouette, wear the same size clothing, and look pretty similar without their clothes on. However, after liposuction, they could look vastly different. So two people whose waists were this big, one person could have a really small rib cage and a lot of fat, whereas the other person could have a little bit of fat and a big rib cage. Now, on the surface, they look the same size clothing, same size. But once the fat's removed, the person with a smaller rib cage is going to look significantly smaller. Now, these are things you can't ascertain from just looking at photos. So a lot of patients look at another person's photos on Instagram or on social media. They think, I look sort of similar to them and they got those results, I should have to get the same. That is not the case. That's why every patient is unique and every result is unique. So during the consultation process, these are things that I go over with the patients to give them a realistic expectation of what they can think their body can be achieved after surgery.